Hello students, in this video lecture you will learn about the lung cancer. Lung cancer is a disease caused by uncontrolled cell division in lungs, and cell divides and make more copies of themselves as a part of their normal function, but sometimes they get changes that cause them to keep making more of themselves when they should not. Damaged cells dividing uncontrollably create masses or tumors of tissue that eventually keep organs from working properly. Lung cancer is the name for cancer that starts in lungs, usually in the airways, for example bronchi or bronchioles, or a small air sac which is called alveoli. Now the types of lung cancer. Lung cancer is divided into two major types based on the appearance of lung cancer cells under the microscope. Like number one type is the small cell lung cancer. Small cell lung cancer is about 10% to 15% of lung cancer, and this type of lung cancer tends to grow and spread faster than non-small cell lung cancer. In most people with a small cell lung cancer, the cancer has already spread beyond the lungs at the time it is diagnosed. Since this cancer grows quickly, it tends to respond well to chemotherapy and radiation therapy. Unfortunately, for most people, the cancer will return at same point. Now, the second type is non-small cell lung cancer. About 80% to 85% of lung cancer are non-small cell lung cancer. The main subtypes of non-small cell lung cancer are adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. And these subtypes, which start from different types of lung cells, are grouped together as non-small cell lung cancer because their treatment and prognosis are often similar. The type of non-small cell lung cancer is adenocarcinoma. Lung adenocarcinoma start in cells in the lung that make mucus called epithelial cells, and epithelial cells line the surface of the lungs. Adenocarcinoma is the most common type of non-small cell lung cancer and occurs mainly in people who smoke or used to smoke, but it is also the most common type of lung cancer seen in people who do not smoke. Second type is squamous cell carcinoma. Squamous cell carcinoma starts in squamous cells, which are flat cells that line the inside of airways in the lungs, and they are often linked to a history of smoking and tends to be found in the central part of the lungs near a main bronchus. And the large subtype of non-small cell lung cancer is large cell carcinoma. Large cell carcinoma can appear in any part of the lung, and it tends to grow and spread quickly, which can make it harder to treat. A subtype of large cell carcinoma known as large cell neuroendocrine carcinoma is a fast-growing cancer that is similar to small cell lung cancer. Now let's talk about the symptoms. Lung cancer typically does not cause sign and symptom in its earliest stages. Sign and symptoms of lung cancer typically occurs when the disease is advanced, and the signs and symptoms of lung cancer may include a new cough that does not go away, coughing up blood even a small amount, shortness of breath, chest pain, losing weight without trying, bone pain, headache, and etc. Now the stages. Each stage has several combination of size and spread that can fall into the category. The general staging for lung cancer is stage 1. In this, cancer has not spread outside the lung. Stage 2, cancer is larger than stage 1, has spread to lymph nodes inside the lungs, or there is more than one tumor in the same lobe of the lung. And is in stage 3, cancer is larger than stage 2, has spread to nearby lymph nodes or structures, or there is more than one tumor in the different lobe of the same lung. And in stage 4, cancer has spread to the other lung, the fluid around the lung, the fluid around the heart, or distant organs. Now, the risk factors of lung cancer. A number of factors may increase the risk of lung cancer. Some risk factors can be controlled, for instance, by quitting smoking, and other factors can be controlled, such as your family history. The risk factors for lung cancer include smoking, exposure to radon gas, exposure to secondhand smoke, and family history of lung cancer. In smoking, risk of lung cancer increases with the number of cigarettes smoked each day and the number of years have smoked. And the second is exposure to radon gas. Radon is produced by the natural breakdown of uranium in soil, rock, and water that eventually becomes part of the air breathed. Unsafe levels of radon can accumulate in any building, including homes. Third risk factor is the secondhand smoke. Even if don't smoke, risk of lung cancer increases if exposed to secondhand smoke. And the fourth is family history of lung cancer. People with a parent, sibling, or child with lung cancer have an increased risk of the diseases. Now, the prevention. There is no sure way to prevent lung cancer, but can reduce risk if don't smoke. Like if you never smoke, don't start. Take to your children about not smoking so that they can understand how to avoid this major risk factor for lung cancer. Avoid secondhand smoke and test your home for radon. Avoid carcinogens at work. Eat a diet full of fruits and vegetables. Exercise most days of the week. If you don't exercise regularly, start out slowly. Try to exercise more days of the week. Now let's talk about the diagnosis. Lung cancer is diagnosed through imaging tests like an X-ray image of lungs may reveal an abnormal mass or nodule. A CT scan can reveal small lesions in lungs that might not be detected on an X-ray. Sputum cytology, like if you have a cough and are producing sputum, looking at the sputum under the microscope can sometimes reveal the presence of lung cancer cells. And lung biopsy, a small of abnormal cells may be removed in a procedure called a biopsy. Now, the treatment. Lung cancer treatment includes surgery, radiation therapy, chemotherapy, targeted drug therapy, and immunotherapy. Radiotherapy. Radiation uses high energy beams to kill cancer cells. It can be used by itself or to help make surgery more effective. Chemotherapy is often a combination of multiple medications designed to stop cancer cells from growing. It can be given before or after surgery or in combination with other types of medications like immunotherapy. Chemotherapy for lung cancer is usually given through an IV. Surgery. Non-small cell lung cancer has not spread, and small cell lung cancer that limited to a single tumor can be eligible for surgery. Surgeons might remove the tumor and a small amount of healthy tissues around it to make sure that they don't leave any cancer cells behind. Immunotherapy, our bodies usually recognize cells that are damaged or harmful and destroy them. Cancer have a way to hide from the immune system to keep from being destroyed. Immunotherapy reveals cancer cell to immune system so own body can fight cancer. And fifth treatment is through targeted therapy. In some people with non-small cell lung cancer cells have specific changes that help the cancer grow. Special drugs target these mutations to try to slow down or destroy cancer cells. Other drugs called angiogenesis inhibitors can keep the tumor from creating new blood cells which the cancer cell needs to grow.